Thanks for coming, and I'm worried about you guys getting lunch. Shows how tuned I am into my stomach. Anyway, yeah, I'm a really old family doc. I've been here in Grand Junction for 38 years this fall. And here to really talk about, and mainly to interact with you all, about three topics. One is about the doctor-patient relationship and how to get what you want from your doctor. We'll talk a little bit about medical economics, how to get what you need without breaking the bank. And then finally talk a little bit about drugs, pharmaceutical products, and maybe some things to go about that. So this really is meant to be informal. If I say something that you don't agree with or offends, why, let me know. And there's no silly questions. And so hopefully you can make it really interactive. First thing I thought we might talk about is the whole business about making appointments and getting in to see the doctor and how to make that work for you. And I'm going to follow sort of the outline that you have. So one of the first things, and this is for a lottery ticket, patients find fault with doctors about two things. And one of them is that most people think, and probably is true, doctors make too much money. What's the other thing that patients get upset with doctors about? Yes?
Wait time.
Wait time, absolutely. You can quit your job now. So, yeah, right, yeah. So that's exactly right. We hate to wait. I think about all the patients who've told me over the last 38 years they were going to send me a bill for how much time I made them wait. And so over the years I've become really, really sensitive to that. So what I'm going to tell you today, and this is not rocket science, but it's how you know, if you know that you can go to the first appointment in the morning or the first appointment in the afternoon, that's the time the doctor is most likely to be on time. And your wait time, we've studied that, and the wait time through the morning gets longer and longer. In the afternoon it gets longer and longer. And maybe you've got a doc who always sees you on time, and that's great. Stick with her, stick with him. But you know, if you can get the first appointment, either the morning or the afternoon, that's good. Mondays are not a good time to go to the doctor's office because the docs are getting, you know, lots of calls from the weekend. Their schedules tend to be packed, and you tend maybe not to get the time that if you can put it off. Obviously, if you're bleeding, go to the doctor on Monday or Sunday night or whenever. But so I guess that's the first thing I want to talk about is being smart about your appointment. The other thing is if you need a physical, and there's a typo in there, my fault, that says physicians, should say physicians often get behind in scheduling annual physicals. You know, we are creatures of want to take care of what's in front of me right now, and so sometimes you call your doctor and yeah, we can get you in July of 2014 for your annual physical. So think ahead about that. If you know that you need it next February, why call now? They may not have the schedule in, but in most offices they'll write it down, and so you can get in when you want to be seen. So that's one of the things about scheduling. The second thing that I wanted to talk about is the concept of the yellow ticket. Anybody know what that means? Yeah, it's pretty obscure, but there was a British general practitioner who, now 70 years ago, studied a whole lot about what happened between doctors and patients. And one of the problems that he noted, and we still note it today, is the concept that when you call for an appointment, you don't really tell the receptionist what's going on. And it's particularly true if there's some emotion or sex or private body parts about it or something that's embarrassing or something that's going on in your family that you really don't want to tell another person. And what I'm suggesting to you is try to get over that and try to let the receptionist know what it is you're really there about. You know, if you tell the receptionist that you've got a sore throat and what you're really worried about is a lump in your breast, why, you know, you're going to get scheduled maybe 10 minutes for your sore throat, which is the appropriate time. It's certainly not time to deal with something that's emotionally fraught, and it's going to take some time to sort out. So as much as your own style will allow you, I'd really encourage you to avoid the concept of the yellow ticket. You know, tell the receptionist really what you're looking for, you know, what kind of problem you've got. Questions or concerns about that? Sometimes that's hard, you know, to say, oh, I've got a drainage from my penis or a vaginal discharge, or, you know, those are things that are hard to come out of our mouths. But you're more likely to get what you need if you can be up front. The other issue related to that is, and I think over the next 15 and 20 years, consumers of medical care are going to see some things happening more with media, with email, with portals in offices. There are a whole lot of things that I've seen in my career where somebody really didn't need to come to the office. They just spent a $100 bill that would be spent doing something much more fun. And right now, in most places, docs don't get paid for responding to your email or putting a message through a portal to an office or answering a phone message. But I think you need to push that system. And if you think that this is something that can be solved over the phone, you know, try to do that. I think, you know, most family docs, we studied it 20 years ago, what part of your day do you spend on the phone? And when we studied that in our office, it was 25% of the time that we were actually in the office, we were on the phone. And I think that's good medicine, and I think in the future you'll see that really ballooning. There's a 98-year-old lady who lives in this facility who I take care of, and I do all the communication with email with her. And saves a lot of money, is efficient for me because I can respond to it if it's not an emergency, and you shouldn't use email if you're bleeding to death, or obviously. But I think in the future, and just this week, I was talking with the head of Rocky Mountain Health Plans. He's real interested in the fact that we ought to get paid, physicians ought to get paid for taking care of people over the phone, and how can a health insurance company lead to that? You know, one of the things that we've done for the last 20 years is if you're a young, healthy woman and you have urinary symptoms, there's a protocol. You can call the office and say, I'm burning, I'm stinging, I'm not pregnant, and I haven't been on antibiotics recently, and we'll call in a prescription over the phone. And that, you know, saves a lot of doctor time. It's good for you. It's efficient use of your time and your money. So those are the kind of things to think about that maybe you really don't need an appointment. Questions about those issues? Okay, so now you've made the appointment and you're going to get prepared for the visit. And there's the sign that talks about prioritizing what you want to go into. You know, you're going into a system that is really, really time sensitive. My watch used to drive me crazy. And 10 years ago, I quit wearing my watch because I was always behind, always feeling guilty. And in primary care, at least, that's the nature of the beast. When you go to your pediatrician or family doc or internist, they are always under the gun. And what that means is that you don't want to spend a lot of time with pleasantries, okay? If you end up finding out, you know, about the doctor's 3 kids and where they've been, that's fine, but I think you need to think ahead of time about what you want. And what I've suggested to people is they write down what are the 3 things or what are the 2 things that you really want answered, that you want to, when you get back in your car to come home or back to work, that you've had answered. And I think a lot of times we fail to do that. And anybody know in there's what I describe as the doorknob phenomena? Do you know what the doorknob phenomena is for a lottery ticket?
You forget.
You forget, and what happens? Who's got their hand on the doorknob?
Oh, I don't know. Maybe. I forgot.
Okay, it's the,
All right,
the doctor's got his hand on the doorknob. He's leaving the room, and you say, oh yeah, I forgot. I've got chest pain all night. And that really happens a bunch, where the critical issue is one that gets left until the doctor's walking out of the room. And then you're going to get short shift. You're not going to get, hopefully if you've got crushing chest pain, you'll get what you need. But you won't, it's a whole different game then. And so again, I urge you to make a list, and fairly quickly, after 30 seconds worth of pleasantries, you get into it, okay? And why is that important that you have in your mind? Well, there was a study done once that put a videotape and a timer that the doc or the patient couldn't see in a room, and they studied how long it was before the doctor interrupted the patient, okay? So the doctor says, what's going on today with you? And you allow the patient to talk. How long before the doctor interrupts? What do you think for a lottery ticket?
45 seconds.
45 seconds. 30 seconds. 15 seconds. 17 seconds is the answer. 17 seconds. So you've got to be pretty organized if you only get 17 seconds. Yeah, and hopefully your doctor does better than that, but again, remember what I told you about the time urgency, And good doctors, sit down and listen and listen and listen. And if you took those patients and you never interrupted them, how long would the average patient talk? Except with one lady I'm thinking about, who would talk, it's 2 to 3 minutes, And, a long time ago, William Mohler, a famous doctor, said, if you listen to the patient, they'll tell you the diagnosis. And that's exactly right. So you need to go in prepared to tell your story. Tell the doc what's going on and stay on track. Don't let the doctor get you off track. The other thing that happens sometimes is you come in for your bad cough, and I see this spot on your arm, and I get really focused on your spot, and we're going to take care of your spot, and we forget about your cough. And you get back in the parking lot, and you said, well, he didn't, So sometimes what doctors are most interested in, he knows in his head your cough doesn't mean anything, and he's more concerned about the spot. Sometimes you need to redirect your doc about what's going on. Okay, so you're in, you've having the visit. What if you're going to have a visit about something that you're really, really worried about? And you're worried that you might not remember everything that the physician says. And does that ever happen? Yeah. How much do you think most of us remember 2 hours after we've had our doctor's visit? What percent of the facts?
30.
Yeah, it's about 20 or 30%. And if you get old like me, you don't really remember anything. So one thing that I talk to people about is if it's something that, like you had your last visit and you really didn't understand what the doc was saying, or you are real worried about what's going on, you think you've got cancer or diabetes, new diagnosis or something like that, take somebody along. write down everything the doc says, you know. Lots of physicians are getting better about writing instructions out, and you leave with something handwritten or printed out, but that always doesn't happen. And so it's fine to take along a scribe, or it's fine there to take a pencil and pad and write down what you're being told. I think that makes for better medicine, and I think you know, docs are not going to object to that at all. You know, the bottom line about when we go to the doctor, we want a diagnosis, but what we really want is we want a prognosis. If she comes in with a cough, she really wants to know it's mild bronchitis or it's a sore throat, and it's not that she's had a clot to the lung or that she's got lung cancer. And so it's a real reasonable thing, particularly when you're thinking about things that you're worried might be more serious, to really tune in to asking the doc the question, what's going to happen with this illness? I mean, that's why we go to the doctor. If we all thought we were going to get well the next day, we'd never go to the doctor, and appropriately so. But I think it's sorting out and helping the doctor sort out with you, you know, what's going on. What can I expect to handle? What can I expect to have happen to me? So what if you've spent 15 or 20 minutes with your doc and you feel like maybe the doc really doesn't know what's going on? And maybe there's just this lingering feeling that the doc doesn't think it's anything bad, but you're really worried. And that brings up the topic about getting a second opinion. And, you know, and that's an area where for a lot of us, that's really difficult to do. To say to the doctor, you know, I'm not sure you know what's going on. I really want to go see somebody else. You know, and there are kinder, softer ways to do that so that you don't have to feel. You know, you can say, you know, I've been going through this for 4 weeks now, and I'm not better. And a lot of times it's real convenient to say, my husband, wife, son, daughter, grandma wants me to go get another opinion. It is always reasonable to get another opinion. Okay, it is always reasonable. If you have what I call crisis of confidence, meaning that you're not sure where this is going with your physician is not going in the right direction, it's really appropriate to ask for a second opinion. And I think that I think that's a difficult thing for some patients to do. But I think you can do it using the kind of terminology we just talked about. That you can make it non-threatening to the doc. Yeah.
So if you go for a second opinion, excuse me, in the same practice,
Mm-hmm.
then your insurance would cover that. But if you're really thinking that all the docs in the practice talk to each other,
Mm-hmm.
and say, oh, well, yeah, that's what he said, he must be right, and then your insurance doesn't cover going to a different doc, what would you do?
Well, and ordinarily it probably is smart if you're going to get another opinion to go someplace else. And in primary care, you know, often we'll send somebody to a specialist to get a second opinion, somebody who has more depth of knowledge about whatever the problem is than I might have. And so there are some economic issues there, and I hear what you're saying. Although at times, at least in our practice, if I have my partners come in and look at rashes or listen to stories, and I think patients get good second opinions because we're not afraid ordinarily to say, no, that's not what I think something else. And so, yeah, I think a lot of that would depend on what you as the patient felt comfortable with. But I don't think necessarily because it was going to happen in the same office that it would be a rubber stamp. I think it's potentially you can get a second opinion. Yeah. So Okie doke. So the cartoon there talks about the whole concept of what's happened in medicine since I went into medicine a long time ago. When I went into medicine, it was really a paternalistic system. You go to the doctor and the Father, Doctor, God said, you shall do this or that. And fortunately, I think that's almost dead. Medicine, more and more, how we interface with caregivers is more on a level playing field. And you know, you don't sit up on a high stool and look down at the patient, and so I think that's good, but you have to play that role. And I think it's fine sometimes to say to the doc, well, what would you do? But remember that what treatment you want to do, what kind of testing you want to do is an important part of the whole healthcare plan. And I see more and more that physicians playing roles of educators and of people that help people understand about testing. You know, for example, right now, there is significant controversy if you're a lady who's 42 years old and never had a mammogram, should you get a mammogram, okay? And so for me to tell you, yes, you need to get a mammogram, or no, you don't get a mammogram would not be good medicine. What I should do is sit down and take 10 minutes to say, these are the pros of getting a mammogram at age 42. These are the downsides, you know. Pros, you might find something you didn't know was there, potentially could save your life. Would be a rare phenomenon in a 42-year-old lady. Downsides, costs money, sometimes it's uncomfortable, sometimes they see things on shadows that really aren't there, sometimes you have to get needles stuck in you. And so that's the kind of thing where in the end the doctor shouldn't make that decision, but the patient should help make that decision with the doctor's help. Same sort of thing with PSA testing. You've seen the controversy about that as well. You know, one other thing about the doctor-patient relationship is the whole concept of what happens when the doctor-patient relationship is really broken. In other words, you have decided that I need more than a second opinion, I need a new doc. And how do you handle that? And that like getting a second opinion, and maybe even more so, is sort of emotionally fraught. How do I go tell this guy or lady that I don't want to be their patient anymore? And again, I think if you don't trust the medical care you're getting, then you need to switch horses. And I'm not suggesting that we do that rampantly, but what I'm giving you permission and urging you, empowering you, that if you really feel like the relationship is not working well, and the biggest issue is the issue that we talked about earlier, that my doctor doesn't listen. You know, your doctor can make you wait 6 weeks to get an appointment, make you wait in the waiting room for an hour. The waiting room is cold and drafty. The nurse is less than pleasant, but if your doctor listens, you'll come away feeling good about it. If your doctor doesn't listen to you, and there's a consistent pattern to that, then it's real reasonable to switch horses, so to speak. And I talk about this kind of blithely, and it's a difficult thing to do, but I still think there's something very special about the doctor-patient relationship. There ought to be mutual respect, there ought to be mutual trust, and when you don't have that, well, then you need to look otherwise. And I think you use some of the same kind of terms when you fire your doctor, that blame it on your husband or your wife or your boyfriend or whatever, but it's an okay thing to do, okay? So, questions about that? hard things to think about sometimes. Let's let's talk a little bit about medications, about drugs. You know, they're a significant part of healthcare costs, and just two or three things that I'd like to talk to you about there. One's about antibiotics. We're heading into the fall season. We're all going to get colds, and you know, the question for a lottery ticket, you know, do antibiotics make colds well any quicker? No, they don't. And you know, if you give 8 people amoxicillin, at least 1 or 2 of them will get diarrhea. And so you traded your runny nose for diarrhea. And so, and your cold doesn't get better any quicker. So, you know, and we know over and over again that doctors want to please, you know. And if you come in and you're spending, or somebody is spending, you know, $85 or $100 for that visit, and you walk out with